Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Welcome to this week's episode of rePROs Fight Back. Today we're going to talk about what is SRHR. In our podcast, we use the tagline, a podcast about all things repro. And that's not exactly true about what we talk about. We talk about all things sexual and reproductive health and rights. But what exactly is that, and what does it mean? Today, I am extra excited about our guest. When we started thinking about doing this podcast, even before I was sure, I have never had a bigger cheerleader or someone who was more excited about the idea of this podcast than today's guest. So I'm super excited to have her on today. Helping me talk about SRHR, I'm really happy to have Nina Besser-Doorley from the International Women's Health Coalition with me today. Hey, Nina, and thanks so much for being here.
Hey, thanks for having me.
Before we do a deep dive into what the component parts are of sexual and reproductive health and rights, or what we'll probably say SRHR for short, because it's kind of a mouthful. Do you want to do a quick overview of what we're talking about when we say SRHR?
To speak very broadly, SRHR is the sort of sum of rights and health issues that are related to human sexuality and reproduction. So you can either see this as a combination of four specific elements, sexual health, sexual rights, reproductive health, and reproductive rights. Or you can sort of look at it as a complex and often intersecting set of issues that affect whether people can fully control their sexual and reproductive lives, whether they can maintain a state of physical, mental, and social well-being. I'll point out a couple of things up front. And the first is that these are often seen as women's issues. You know, reproductive rights is seen as something that affects women. And obviously that's true in part, but I really want to convey that everyone has sexual and reproductive health needs and reproductive rights and sexual rights. And SRHR is closely linked to women's empowerment, and the lack of SRHR is a massive barrier towards gender equality. But it can't just be seen as a women's issue. These are issues that do impact all of us. And I think the sort of other thing that I'll point out up front is that a lot of times when we hear reproductive health or reproductive rights, we immediately think of abortion and contraception. And these are important issues within this sort of overall heading of SRHR. But again, it's really far from the entire story. And I'm really excited to talk to you today about sort of the full range of issues that fall under this very broad heading of SRHR and what are all the pieces we're talking about when we start diving into these issues.
So we'll start at the four parts that are included. Let's start with reproductive health.
A lot of these terms, there are some places where they overlap. There's some overlap between reproductive health and sexual health, for example, but they all do mean distinct things. So what do we mean by reproductive health? We can start with the WHO definition. The World Health Organization offers a definition of health that defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And within this framework, the WHO defines reproductive health as the set of issues that address the reproductive processes, functions, and systems at all stages of life. What does that mean? So, according to the WHO, reproductive health implies that all people are able to have a responsible, satisfying, and safe sex life, and that they have the capability to reproduce and the freedom to decide if, when, and how to do so. So, this means they have access to safe and effective and affordable means of contraception if they want to delay reproduction or avoid reproduction. It means they have access to appropriate maternity care, prenatal health services if they choose to reproduce. And so within this, there are a number of components beyond just contraception or maternity care. There's information about the reproductive system, so people understand what it is that goes on with their bodies, what the range of choices that they have, and how to maintain control over their reproductive system. It means access to a variety of methods of contraception so that people can choose the method that is best for them. Do they want something that's long-acting and they only have to use once in a blue moon, or are they okay with a method that they have to take every day and continually monitor? Are they aware of the side effects that can come with certain forms of contraception? And are they able to make the decision that is very much right for them? It includes access to safe abortion and post-abortion care and those critical services. It also includes issues of menstruation, the ability to manage menstruation in a hygienic and dignified way. Again, the understanding, particularly for women, of what's going on with their bodies when they do menstruate and how that plays into their reproductive lives. And they're also, it's the ability to postpone having children, but it's also the ability to have children. So this includes appropriate healthcare services for pregnancy and childbirth, but also access to services, information, and treatment surrounding fertility and infertility for people who do choose to go that route. And I guess the last thing that I'll flag that reproductive health often encompasses is the prevention, treatment, and care of reproductive health diseases and cancers and a whole set of what we classically see as health care, the disease portion, the ability to manage these diseases of the reproductive health system. So in short, that was long, but the short summation is that reproductive health is that we're talking about the entire set of healthcare services and information and the resources that enable people to lead healthy reproductive lives.
And one of the things I saw in there, and I think it comes up in a couple of the other definitions too, that always tends to get buried, but it's great to see there, is satisfying. That often isn't something that's talked about. It's so often, as a health need or a preventative, or you don't often talk about having satisfaction from having sex. That's the thing that doesn't get talked about.
Yeah, absolutely. And I think there are several, particularly when we get to sexual health, there are several components where sexual health really goes beyond some of the pieces that are included in reproductive health to really hone in on some of those sexual needs that are different from just being about reproduction.
Right. So next, after reproductive health, comes reproductive rights. Do you want to talk about what's included in reproductive rights?
So moving away from the World Health Organization for a minute, the reproductive rights have an international definition that comes from the Program of Action from the 1994 International Conference on Population and Development, which we also often refer to just as ICPD. This definition has stood up for the last, 20, 30 years. The definition offered by ICPD is these rights rest on the recognition of the basic right of all couples and individuals to decide freely and responsibly the number, spacing, and timing of their children, and to have the information and means to do so, and the right to attain the highest standard of sexual and reproductive health. So this is really important because ICPD was a negotiated agreement between countries around the world, and it's really been sort of the accepted definition of what we mean when we say reproductive rights and what's included. So what are we talking about, right? That's a kind of a wonky way of saying this, but we're talking about the ability to make decisions about reproduction. So if you want to have kids, when you're going to do it, who you're going to do it with, if you don't want to do it, if you don't want to reproduce, and to do that without being coerced or forced in any way to do so. Our reproductive rights as individuals, they include these pieces of to try to have kids if I want to not be bullied or forced into getting pregnant by a partner or a family member, to decide I might want to have children with one person but not with another, or I might want to do it on my own without a partner. I might not want to do it when I'm 20 years old and doing something else, completing a college degree, but I might want to do it when I'm in my 30s. Or I might not. I might go my entire reproductive life and choose not to have kids. Those decisions are going to look really different for each person, but the concept of reproductive rights is that each person gets to make those decisions and gets to figure this out for themselves. So we've talked about contraception a little bit under reproductive health. And this is a really key component. Access to contraception, to effective methods and to a variety of methods is a really important part of reproductive rights as well, because if women in particular do not have the ability to avoid pregnancy at times that they don't want to, they don't have full control over their reproductive rights. So this is something that's been actively debated in this country in recent months and years around the contraceptive mandate under Obamacare and the importance of providing that option for everyone, regardless of their income or where they live. And the same thing is true globally. You know, the idea that where you live shouldn't dictate, or what resources you have shouldn't dictate whether or not you're able to access the means of controlling your reproduction.
Or the kind of method you can use.
Exactly. And in too many cases, women are presented with only one option, or, you know, they don't have a full range of methods available to them. And that makes a big difference because some women have strong preferences, or some women's bodies do way better on one method than another. Or some women may have issues where they can't talk to their partner about it, or they need the ability to have discrete methods of contraception. So these issues are really important.
So that's reproductive health and reproductive rights. So let's move on to sexual health.
We'll go back to the World Health Organization for a definition for sexual health. And the WHO describes sexual health as a state of physical, emotional, mental, and social well-being in relation to sexuality. It's not merely the absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So there's going to be a lot of overlap here between sexual health and reproductive health because sex is a key component of reproduction.
Right.
But sexual health recognizes that reproduction isn't the only reason that people have sex, and it's not, reproductive health needs aren't the only set of needs that are associated with this. So some examples of sexual health issues. So prevention and control of HIV and other sexually transmitted infections. Physical and mental health issues around sexual functions. So that could include treatment and counseling for sexual dysfunction and disorders. Sexual health can include issues of gender-based violence and ensuring that individuals are safe from sexual violence. And it also includes education and information. So access to accurate and comprehensive information about sex, sexuality, safe sex practices, and related issues so that people do understand, particularly young people, understand what's associated with sex and all of these different components that go along with it. I mentioned this already, but I think it's really important, and I'll go back to it, that it's really critical to recognize that there are distinctions between sexual health and reproductive health. And this is really important in women's health in particular because it recognizes that women aren't just reproductive vessels. There are lots of reasons that women choose to have sex. And reproduction is part of the equation for women. It has to be part of the consideration, but it's not the whole story. There are plenty of people for whom reproduction is not an option for whatever reason. It's not even part of their decision-making around sex, whether it's because of the relationship that they're in, issues of gender nonconformity, issues of infertility. There's a whole set of reasons why people aren't maybe having sex and not even thinking about reproduction, and they still have sexual health needs. So this having these pieces fit together is able to encompass a much broader set of issues.
So the last bit is sexual rights.
Yeah, so sexual rights. So of the four component parts, sexual rights is the place where there's still some active discussion around what the best definition is. I think we have a firm understanding of what we're talking about, but there's not one accepted definition for it. Maybe the easiest and the simplest is found in the 1995 Beijing Platform for Action. So this is a year after the ICPD defined reproductive rights. Beijing refers to the right to have control over and decide freely and responsibly on matters related to their sexuality, including sexual and reproductive health, free of coercion, discrimination, and violence. And the WHO has gone on from that. They have a fairly lengthy working definition of sexual rights that highlights a number of components around privacy, around the right to be free from torture and cruel, inhuman, or degrading treatment, the right to marry and to found a family and enter into marriage with the free and full consent of the intending spouse, the right to decide the number and spacing of one's children, and another number of other components around this. And the WHO goes on to state that sexual rights protect all people's rights to fulfill and express their sexuality and enjoy sexual health with due regard to the rights of others and within a framework of protection against discrimination. And there are other international agreements that have gone farther, particularly at the regional level. A definition that I really like comes from the Montevideo Consensus on Population and Development in 2013, which is a Latin American regional negotiation between governments in that region. And they define sexual rights to embrace the right to a safe and full sex life, as well as the right to take free, informed, voluntary, and responsible decisions on their sexuality, sexual orientation, and gender identity without coercion, discrimination, or violence, and that guarantee the right to information and the means necessary for their sexual health and reproductive health. So these are a lot of international agreement definitions, and in terms of what they really mean and what they all have in common is that sexual rights is about the human rights of all people to make decisions about their sexuality, about their sexual life, and to achieve the highest attainable standard of sexual health. So practically speaking, this can mean a number of things. So you have the right to decide if, when, who you're going to have sex with. Are you going to do it? Who are you going to do it with? Who do you want to have sex with? You can't be coerced into having sex. You have a right to not face violence surrounding sexual activity and to be forced into sex through sexual assault. It can mean you can't be forced into a marriage or told who to marry. Your parents shouldn't be able to dictate your spouse. You can't be coerced into forming a marriage. And this has big implications. We're seeing this in our society on sort of a constant basis these days with the Me Too movement and women who have come forward and really shown us how prevalent some of these coercion and discrimination aspects remain in the United States today. And these are violations of people's sexual rights, right? If you're forced at work, or if you're put in a situation by your supervisor where you're being asked to do something sexual at work, that's a form of coercion or discrimination and falls very much under this category. And the other thing, which I think we can talk a little bit more about because it's really important, is the implications for LGBTQ individuals. So this is where a lot of the debate remains around sexual rights, but it's not the right to have sex with whoever you want as long as it's the right person as dictated by society and the government or whoever. It's to decide on all matters related to your sexuality, right? So it does enshrine the right of people to form relationships with who they want, and that has very, very important implications for LGBTQ equality and those related issues.
Good, and I know we've touched on some of the international agreements that shows kind of how those definitions were crafted. So maybe we want to talk a little bit about the history of the SRHR movement in a more straight line.
These issues, SRHR issues, have a significant history of recognition at the United Nations and in international agreements between countries. And that, I think you can trace back to seeing some of these concepts in the 1960s, but 1994 and the International Conference on Population and Development, ICPD, is really sort of the breakthrough moment where reproductive health is defined and elements are listed that of what reproductive health care entails. Reproductive rights are defined and linked to established human rights and international law and linked into the system. Cairo was really sort of, I think, a critical moment for the movement because it moved sort of beyond just a population control or demographically focused approach to all of these issues and started instead looking at human rights, the rights of individuals, centering the agreement on women's human rights. And this is a really major shift and one that has been echoed then through in the intervening years since then. And sort of similarly, the Cairo Agreement really rooted policy on population and development issues in gender equality and women's empowerment. And that's been built on since in a couple of really critical ways. But it really sort of solidified this idea that these issues, SRHR issues, are critical to successful development policy, and that they have this sort of range of repercussions across women's lives. And that's a really important acknowledgement. And this was due to some really sustained long-term and strategic advocacy from women's rights groups, feminist groups who turned out in force in Cairo and really were instrumental in making this happen. And then they came again in the following year to Beijing. And, I think in the women's rights community, we sort of all remember the women's rights or human rights moment in Beijing with then First Lady Hillary Clinton and that sort of being a moment for a lot of gender issues and women's rights issues. And for SRHR, Beijing, as we talked about previously, Beijing really took SRHR a step forward by introducing this component of sexual rights. And so it doesn't use the term sexual rights, but it uses it encompasses the idea of the right to control sexuality. And this was, again, it's a major win, and it's something that came about through sustained and strategic advocacy from the women's movement and feminist groups who were both active within the negotiation spaces in Beijing and also in the very vibrant civil society spaces that were part of that conference.
So now that we know a little bit of the history behind the SRHR movement, let's talk a little bit about what has been happening at the United Nations in the last several years.
Since these sort of landmark agreements of the mid-1990s, sexual and reproductive health and reproductive rights have been repeatedly reaffirmed through international negotiations. And yet, despite over 20 years of agreement and consensus around these issues, we've still seen regressive governments continue to repeatedly try to undermine commitments and walk back some of this language. What we've seen in practice is that the basic concepts agreed to at ICPD and Beijing have been repeatedly reiterated in documents negotiated at the UN, and there have been some additional and very hard-fought advances. And one of the most significant of those ways we have been able to move the conversation forward came in 2015 with the adoption of the Sustainable Development Goals, or the 2030 Agenda. So this is the global development framework that was negotiated over several years and agreed to by the global community in 2015 at the UN to replace the Millennium Development Goals and really sort of lay out a shared development vision for the next 15 years, looking ahead to 2030. And in this agreement, governments made a number of specific commitments, really sort of around ensuring universal access to sexual and reproductive healthcare services and in universal access to reproductive rights in accordance with these agreements laid out in the 90s. And the SDGs went a little bit farther because they really linked SRHR and these issues to the broader development agenda. So the ways that these issues feed into both the achievement of health outcomes for entire societies and also to goals around women's equality or gender equality and women's empowerment. The SDGs also refer specifically to a number of issues that fall under an SRHR sort of umbrella. So commitments around ending child early and forced marriage, for example, specific commitments around reducing global mortality rate, ending the HIV epidemic, and achieving universal health coverage, all of which are critical to this conversation. So we have seen some real advancement since the 90s, and that has been through really sustained advocacy, through a lot of engagement with member states at the UN who do support these issues, and pushing back against some of these efforts to roll back commitments. There are a handful of areas where progress has been really hard, though, and we haven't seen a lot of progress since the 90s. And one of these is abortion. ICPD includes language around language calling for abortion to be safe where abortion is not against the law, and that's a quote. Beijing goes a little bit farther and calls on countries to review laws that criminalize abortion. But despite sort of overwhelming evidence documenting that women die when they lack access to safe and legal abortion, the the international community has been really unable to come to consensus around protecting access to abortion services, it's a huge problem, obviously. Like the WHO says that up to 13% of all maternal deaths are attributable to unsafe abortion, and says that almost every abortion death and disability could be prevented through sexuality education, use of effective contraception, provision of safe, legal, induced abortion, and timely care for complications. So it's really quite, it's one piece, but it's a huge problem that the international community hasn't been able to really take this one on. And a second place where some progress has been slow and really hard to reach this international consensus is around sexual rights. Sexual rights were omitted from the 2030 Agenda and the SDGs. There, we talk about sexual and reproductive health and reproductive rights. And so if you're looking at the SRHR, the piece that's missing is the SR, the sexual rights. In sort of repeated negotiations, the international community has balked at using the term sexual rights in international consensus documents. And regressive governments have taken aim at this term both over the issues of women's and girls' bodily autonomy and their control over their sexuality, as well as over the recognition of diverse sexual orientations and gender identities. So this has become a sort of a loaded conversation in UN spaces, and one that has made progress forward difficult. And I will say, the lack of inclusion of language on sexual orientation and gender identity back in Beijing in 1995 was a source of disappointment for my organization and for a number of the other groups that were there. And this has really continued because, again, this is a huge issue. Individuals in this country and around the world continue to face violence, harassment, and discrimination because of their sexual orientation or gender identity. And many governments pursue policies that make this worse, right? That not only fail to recognize the human rights of all people, but actively criminalize them based on these grounds. So again, this is one specific place within SRHR where it's been difficult to advance international consensus, and the repercussions of that are significant around the world.
Absolutely. I mean, you've definitely seen places like Uganda where it's criminalized and people were being killed. Like, it's really an area that we need progress on.
Yeah, absolutely.
We have talked about the UN, and one other thing that we haven't touched on yet is the Trump-Pence administration and how they have affected these things. So over the course of this podcast, we've talked about, their impact on global policies and domestic policies, but we've not really spent time talking about their impact at the UN. So maybe we want to talk about what has changed since the Trump-Pence administration took office.
Since President Trump took office, I think we've really seen two things which, taken together, are having a really massive impact globally. And that's what the U.S. is doing both domestically and in terms of its foreign policy in attacking SRHR. Many of these issues you've talked about on your podcast, but things like re-implementing the global gag rule, defunding UNFPA, the UN's reproductive health agency, and these sort of attempts to cut funding for bilateral programs. These are sort of U.S. foreign policy pieces. And then that's been coupled with really persistent attacks on the UN, on the fabric of multilateralism, the international system, and the idea of U.S. leadership in these spaces. It's having a sort of a snowballing effect, I think. The U.S. is the largest funder of global health and reproductive health, so what the U.S. says on these issues really matters, and the U.S. has a big voice on these issues. And in the past, under the Obama administration, we really saw at the UN the U.S. in many cases being a champion for particularly for reproductive rights and reproductive health, and really actively leading the charge on this. And under this administration, it's really quite the opposite. So they've taken sort of every opportunity to undermine language on sexual and reproductive health and rights, as well as to undermine the UN system itself and the processes of multilateralism, which I think is sort of a separate issue, but it's important to recognize the sort of the ways that they're delegitimizing the system and not working within the established framework. I'll throw out a couple of examples of what we've seen since this administration has taken office. Every year, countries meet for the Commission on the Status of Women. This is an annual UN space where it's the major international space where countries are able to review progress on gender equality and women's empowerment, and they negotiate an agreement at the space. And the Trump administration, both years since being in office, has included delegates on the official U.S. delegation who have been committed to walking back commitments on SRHR. So in 2017, it was a delegate from an organization called CFAM, which is designated as a hate group by the Southern Poverty Law Center and known for its extremist opposition to both women's health and rights and LGBTQ rights. And then in 2018, it was a political appointee from USAID who had caused outcry when she was appointed to that position because of her history of aggressively crusading against transgender rights, and including her as part of the negotiating team this year. So, we saw U.S. negotiators stating the U.S. is a pro-life country, disregarding the fact that both U.S. law and public opinion support the right to access safe abortion. We've repeatedly seen U.S. diplomats pushing for changes to some of these long-standing agreed language pieces that we've discussed already on SRHR, and calling for example, deleting references to modern contraceptives, really sort of pushing some of these places where there has been long-standing agreement, pushing against that. And in practice, this has made the U.S. sort of one of the most regressive countries in terms of sexual and reproductive health and rights in the UN space, and has threatened long-standing international consensus on these issues. This is a huge change. We saw during the SDG process leading up to 2015, we saw the Obama administration really playing a critical role in ensuring that in the end stages of those negotiations that these issues were included. And now to see the Trump administration taking the opposite approach really sort of emboldens and empowers other regressive governments to also really dig in their heels on this. So it makes the whole process of consensus on these issues really much more challenging.
Yeah, it's particularly horrifying to see them arguing against modern contraceptives. Like, that seems such a basic thing that women need. To hear that our government at the UN is fighting against that is pretty atrocious.
Yeah, absolutely. And there's so much evidence around it. There's so much evidence on what works for women and what women need to control their reproductive lives, and to see this pushback that goes back decades is really, really disturbing.
So far this conversation has been pretty, a little wonky, a little policy focused. So maybe we should bring it back to me. How does SRHR affect individuals?
That's a great question, because I in DC we sort of get caught up in the wonky and the definitions and all of these various policy pieces. But I think we'll go back to where we started, which is that everybody has sexual and reproductive health needs, and everybody has sexual and reproductive rights. And so what does that look like in your life? Sort of every day people are deciding whether or not they want to have sex, right? They're deciding if they want to get married, who they want to get married to, if they want to have kids. And if they do, how are they going to make it happen? If they don't, how are they going to prevent it from happening? What are the options available to them? Every day people are seeking medical intervention to treat reproductive cancer, to prevent it, and to deal with a huge range of other health complications. And whenever you can make these decisions freely and you have access to these critical forms of healthcare, you're exercising your sexual and reproductive health and rights. And I think it's probably more often than most people realize, but it's really a key component of people's everyday lives. And I think we get derailed sometimes because people hear SRHR and think abortion. They hear reproductive rights and think abortion or reproductive health. And abortion is a critical issue. I don't want to downplay it. I love those shirts from the National Network of Abortion Funds that say, everyone loves someone who's had an abortion. Like, the statistics really bear that out. Abortion is a big issue. And in the U.S., 1 in 4 women will get an abortion sometime in her lifetime. So I'm not trying to downplay that.
Right.
But what I'm trying to sort of upplay, the opposite of downplay, I think what's important to recognize is that there's also this huge range of other issues that really do impact us all. Sort of to take it a step further, abortion rights can often be seen as a bellwether for where this is all going. So when these issues come up in policy debates, particularly abortion, I think it's a huge mistake to see it as an attack on one specific service that some people need and some people don't, right? It's an effort to control women's bodies and an effort to limit women's options. Abortion really is a piece, only a piece of this, but it's an indicative piece of policy. So I really sort of urge people in terms of how this affects me to look at where the conversations are on abortion are as an indication of the government's approach to sexual and reproductive health and rights writ large and where we're heading in all of these conversations.
You talk about that as a bellwether. A lot of these attacks are specifically targeted at abortion, but full well knowing they're going to have a much broader impact, right? So closing Planned Parenthood, it's not just about abortion, right? People are going there for their reproductive and sexual health needs, and abortion is just part of that. But if Planned Parenthood stopped doing abortion tomorrow, conservatives still wouldn't be happy, right? They would still be mad that there's this group making sure that people have access to their sexual and reproductive health needs.
Right. And this is, we come back to we talked about the attack on modern contraception. We just see these things escalate. It doesn't stay, even if we see conservatives in power attack abortion specifically, it then also, but we're also sort of attacking contraception. We see it in the challenges to the Obamacare contraceptive mandate. Again, these things, these things are intrinsically linked,
right,
and can't really be seen as, this is one service, so it's okay to not address that one because it's too controversial.
Okay, so I always love to end my podcast with a really important question, and what can people do? What actions can people take if they care about SRHR globally?
Yeah, I think there's a number of things. The first thing I'll say is just be informed. I think global SRHR is in the headlines more now than it usually is, and there are more really good reporters who are covering these issues, even the sort of mundane ins and outs of UN negotiations. But you still have to look for it, and it's often not the sort of above the fold New York Times headline. And so I really think the more that people can seek out information on this, listening to your podcast is a great way to do that, because you've done a really great job of digging into some of the specific issues under this very broad heading, but really, really being informed about these issues and the ways that the impacts that a lot of these policies are having around the world is sort of, to me, is step one. In terms of what to do, though, how to push back, I really encourage people to look to Congress. I used to work for Congress, or work for a member of Congress, so I'm a little bit biased here. But I do think that Congress has a lot of power here to be the check on the administration that they're intended to be. And they can do this in a number of ways, and they've shown some indication already, even under this Republican-controlled Congress, of playing that role. So funding is a key one. The administration has proposed, the first year of the administration, they proposed zeroing out the global reproductive health budget. This past year, they tempered that proposal slightly and only just massively gutted their funding requests. And both times Congress has sort of approached that as a thanks but no thanks, and has continued to fund these programs. So Congress does have that ability to set the final budget and to really push back against some of these most extreme proposals. And sort of similarly, we've seen real intent, some real interest in the Senate in ending the global gag rule. While it wasn't finalized into law, we did see senators of both parties actively push back against this policy. So there are places that Congress has shown some interest and willingness to not just go along with some of these terrible proposals, but to really provide roadblocks. And a sort of a critical place that's ongoing is nominations, and sort of at all levels, from there's a bunch of really critical and still empty State Department positions that the Senate will have to confirm eventually, to all the way up to, obviously, we're seeing in the headlines every day, the Kavanaugh nomination to the Supreme Court. And each of these nominations is an opportunity for the Senate to get a say in who's setting and executing U.S. policy on these issues. So I really think that Congress shouldn't be written off. and that if people are looking for ways to take action, that Congress is a great place to start. And I'll throw out that I having worked in a congressional office, members of Congress do listen to what their constituents say. They don't always act on it, but they listen. And it's important that members of Congress, both those who support SRHR and those who do not, it's important for them to hear that this is an important issue. This is something that their constituents care about, and here's what their constituents, want to see them doing. And that's really important.
And I think particularly on these issues, it's not like ACA repeal where you're getting thousands of people calling into your congressperson's office about this particular issue and you're just another voice. You're going to be one of very few people calling in about this issue, so you have a chance for your voice to kind of make a bit of an outsized impact.
Yeah, absolutely. Absolutely. And I think it's really important, even if your member of Congress votes the right way on all of these things.
Thank you helps.
And they're being asked to put out so many fires right now, and their attention is pulled in so many different directions that the more they can be told, this is an issue that's important to me, this is something I want to hear you speak out on, this is something that is of interest to me as one of your constituents, I think that is really important. I think calling your member of Congress is important. There are a lot of other ways to make your voice heard. And, here in D.C., it seems like there's a protest every week and an opportunity to make signs and take to the streets. And I think those are all really important. And one of the things that I think people can do as they're standing up for women's sexual and reproductive health and rights here in this country is also understand that this administration is pursuing these same policies globally. And in some cases, they're sort of using it as a trial balloon. And I'll go back to the global gag rule. Like, we saw the imposition of this policy globally in the first week of the Trump administration.
Wishful thinking.
We saw the imposition of this policy in the first week of the Trump administration. And now, a year and a half in, they're trying to apply it to organizations in this country, a very similar version of this policy. And so understanding that these global policies, which affect women around the world but may not affect women here, are going to come home. Mm-hmm. And that's all part of this same ideology, this same approach to controlling women's bodies and to really undermining sexual and reproductive health and rights for all people, that it ends up in these policies overseas, but also in the domestic space. So keeping that link in mind and really sort of speaking out on attacks on SRHR sort of wherever they occur.
Well, Nina, thank you so much for being here. I had a lot of fun talking to you. So thank you.
Thanks so much.
All right. Thanks, everybody. For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.